think like and it just goes on. Now we will see the usage of lasers in the pigmentation.
Hi again for my last lectures. First I like this lecture because this lecture my own hear it from me and then tell me can you come to do it the same in Islamabad? Who's doing lip depigmentations here? Nobody? Lip depigmentations? One? Only? Okay. To the best of my knowledge, this is the only method published in medical journal to doing lip depigmentation. Before I start, I have to declare I don't have any conflict of interest. Why people ask for lip depigmentation? I think nowadays there are increase in demand of facial aesthetics among everybody for selfie and for photos. Lip color, what do you think? Lip color, is it normal? Yes, it's normal. The answer is yes. Today we'll have hands-on. Everything, the patient, live demo, the patient is normal. Yes, the answer is yes. Okay. I think this is come from our cultures. Culture is essential in our museum, an ancient museum, if you visited. And for the French people, I like this book. It's called La Description d'Egypte. It says there are no limits of passion of the ancient Egyptian of both colors and funny jokes. The first lipstick, it's invented by the Egyptians, by the ancient Egyptians. It's made of henna, and they found it in Mered's grave. So, after excellent lecture of Sebastian anatomy, just to get it very fast, this is the skin of the lips, and this is the skin of the normal skin. In the skin of the lip, there are no hair, and it's completely different. Okay, let's see what's wrong in this. Pigmentation, it's mean we have excess melanin pigments. So, this bad melanocytes, it's rotated like this, it's full of melanin. So, my work is to target something to dissolve these pigments. Okay, but please remember always it's a medical issue. So, you have to go for the medical examination, medical assessment before doing anything. You have to make a proper diagnosis. Okay, I have to make the consent. The patient is not pregnant, patient is not excessive alcohol intake, and the patient didn't take medications. Okay, this is very important. Let's start the story. The story, the patient came to my office like this and tell me, doctor, I cannot smile wide. I want to be more pink. So, let's go for laser. This is the idea of aiming the laser, like you see now. Okay, I initiate my fiber and I work in a contact mode. This is a fiber. I try to ream it and I work in pulsed mode. This is giving the luxury of laser by decreasing the thermal relaxations and peeling immediately and give the immediate result for the patient. I choose to work in pulsed mode in high power. Okay?
What is the laser?
I said everything, don't worry. Then I start first with biostimulation. Biostimulation is an excellent tool to decrease the pain for the patient. Then I go to increase, to change the power. The most important thing in laser is chromophore. So I use diode lasers. I use 8, 10 nanometers in these procedures. This is after doing depigmentations. Okay, I can do it also for the tongue. Okay, I take the ethical approval and I study the physics. This is Professor Meister. Since 3 years I do 65 cases, and now there are 12 practitioners do the same technique. I have the selection criteria. I make well-motivated patient, no underlying pathology, and not pregnant. And I tell the patient, very important, maybe you have some social lag for 1 week, but nowadays, no social lag. Okay, I publish my technique, and this is my technique of depigmentation in full details. I start with biostimulation first. Biostimulation is an excellent tool. It will decrease the bleeding, decrease the pain, and also it's excellent if I go for the lymph nodes for the area 1 and 2 and 3 and 4 and 5. This is very good to guarantee zero bruising for the patient. Then I go for my peeling. This is the parameter I use in my work. Okay. And I do something. The patient is annoying too much from the smell. So I put some Arabic oud or Arabic smell in the patient's nostril. And I get my assistant ready with high suction. It's very good. I have another secret. From time to time, I ask my assistant to have a cold saline. It's very good. And after finishing the procedure, I advise my patient to take a KY gel as a lubricant to decrease the pain. From time to time, I stop. And most of the time I do this procedure with topical anesthesia. I don't numb the patient. Why? Because I like to keep a pain as an alarming sign. I don't like to burn my patients. See how beautiful the result and how beautiful the patient can become pink immediately? Okay? Sure, if you can go for the lower lip, you have to be very cautious. Why? Not to induct a mucocele for the lip. This is the way I'm going to do. It's very important when I'm aiming saline, I like to take care. I don't like to aim for the laser. Why? Because I will decrease the laser efficiency. After I finish, from time to time, I make biostimulations, and this is one of the luxurious use of the lasers. Sure, when you do laser, you should implement all the safety precautions. Okay, this is another case, and this is after. And this is another case. Let's come to the question. Does it relapse? Yes, it's a natural process. When? After 1 to 2 years. I have cases since 3 years with no relapse. Okay, social lag for 1 week. Is it painful? It's like a hot spice. Okay? Need post-operative medications? Yes. I give analgesia. I give anti-edema for some patients. I never give steroid for one patient. I give the patient instruction, what to expect, what to do, what to avoid. You expect slight pain. You expect slight swallowing. What to do? Take painkiller. What to avoid? Avoid alcohols for 1 day. When not to do? If the patient is critically ill, patient with pregnant patient with a medical disease, red flags like infections, like anything. Okay, this is my kids. Now I think this is a 3 years technique. Till now it grew your contributions. At the end of my lectures, I wish this lecture it opened a door like this. You know what's the door of this? This is the door of King Tut in Egypt, and this is my contact. And be more than happy to answer your questions if you have any questions. Thank you for your time. I'd like to invite you to my congress. Thank you so much. Now we'll come to the hands-on, to the live demo to show the exact details how we can perform it very safely without any pain.
Any questions from anybody? Everybody got it. Injection via diode placing.
What was the video?
Sorry?
What was the video you wanted to show?
What was the video? Right. They're going to take about 5 minutes or 7 minutes to set up their thing.
Yeah, he can play it now.
That you know when you do a concert, when you do a concert and you leave and then the audience calls you back, right? That was a concert. So the video, we had technical difficulties. I just tried to check it again for some reason, but relax. But I thought if I can come back whilst they're setting the next. Is this a live injection session?
Yes, no, it's a live laser.
Okay. That's fine.
Just one laser session.
Perfect, set up. So I thought if I can answer any questions, and there should be lots hopefully, because this is your last day. We haven't really had many questions. Most meetings have time for questions and there's a microphone. So if we have a spare microphone, please, if we can just perhaps give it to the audience and they can ask questions. There should be good questions. So someone asked me about anesthetics earlier. What do I use for my lip blocks? It's such a common procedure, so how do I do my lips? Very simple. Set the scene. Like any good surgical procedure, position the patient, have good lighting, because it's about light and darkness, shadows and light. Create the light so it's natural. Avoid lights from above, so you get different shadows. Because as the patient goes to sunlight, it will appear different. So create your setting for your treatments. Start by making sure that you have anesthetic available. If the person is allergic to anything, make sure that those contraindications are already outruled. I use dental blocks, lower mental nerves and upper lip blocks. I then also go into the philtrum on the inside and I put a little bit of anesthetic. I don't do it over because I don't want my orbicularis muscle to change shape, so I want to try and keep it as natural as possible. That also allows me to check the lips on animation. Once I do that, I use a product that has anesthetic built into it. Some of the products here do not have that, so I use a product for long-lasting anesthetic. Of course, the topical anesthetic is applied as they come in. But because I do lips as part of a full face, as I mentioned, my chin is already anesthetized. My zygomatic bones are already done. So I have a nice upper block for my infraorbital nerves, and I have a nice lower block. So the patient is quite comfortable. All I have to do then, as I mentioned, is put my cherry on that cake, which is already prepared earlier. So most of my patients are full facial patients, and it makes doing lips a pleasure, because I have to do the full nose, upper lips, lower lips, chin in one go. Any other questions, specific ones?
How you go about the lip filling? Go about the lip filling. This is all before that now.
How do I set it up? So
No, you have set up your procedure. Now how you go about the lip filling?
okay, fair enough. So how do I go about it? For me, my left hand is the most important hand, like most good injectors will tell you. Right hand is just the hand that basically controls and pushes the plunger. When I control lips, I have the patient feel like a good barber when you're having a shave and you've got a sharp blade in your hand. Like a good barber, the patient must feel that you're in control, not them. Because the chance of them moving and flinching is very common. They'll do this or they'll do this. And they'll feel as if you're about to inflict pain, especially when they see the needle coming at you. So the technique I have is I have a dental chair, and I approach the lip in a very gentle way, and I talk to my patients. And inside their mind, they're expecting a soft needle. I pinch the lips with my left hand, holding their face firmly, and I'm pushing. It comes naturally, but do not inject like this. Hold the patient from the contralateral side, so you've got counter pressure, and make sure you're in control. And when you're injecting, make sure it's retrograde injections if you can, so you don't propulse product into an artery, as Sebastian mentioned. You can get complications, however, they are there. It's a lucky place. Lips are forgiving. Patients that have lips done are not forgiving. Okay, so that's the key. Lips are forgiving, but the patients are not forgiving, because lips are the cherry on the cake, and that's the polish that you're creating. So you want to make that perfect. Not okay, perfect. And if anyone has other questions, please, I'm more than happy to be approached.
I think it's very difficult to speak. We have to make a laser safety. We wear our goggles. I apply the lump cream. I don't like to make anesthesia injections for this patient. In some patients, I give bilateral intra-aortic blocks. Okay. Before I start, I like to make biostimulations. This is very good to decrease the pain and guarantee zero bruising. Now this is our laser. Okay. I ask the patient to remove the stuff, and I have some gauze trays. Okay. If you have any pain, just raise your right hand, not left, not raise my face. This is biostimulations. You can give the patient certain kind of numb, by the way. Usually we do biostimulations for 30 seconds all around the lip, like this. Okay, now I have to connect the fiber. Can you connect the fiber, please? I connect the fiber of the lasers. It's very important. You should have initiate the laser fiber. Why? I reinitiate it again to show them. For me, I'm obsessed. I like to usually to initiate my fibers. Why? I like to check the alien beam. Everything is fine with the machine. Here, this is initiation. Yes, it's fine now. Okay, my laser is ready. Okay, the key, I have to move very fast, not to burn or to make pain for my smart friend. Do you have any pain? You have pain? Okay. Everything is fine. You have to press a little. See how the pigment is gone? We can go fast like this. Okay, going like this. We remove the pigments and going for the other side. Okay. See the pigments gone now? Very safe cleaning without any. The secret I like to move very fast. Okay, I go for the upper. Now the pigment is gone from the lower and from the upper. I like to go for the middle and that's it. Still have fine pigments, I have to get a low power now. Almost I finish. See, now it's a crust, the crust has come out. Okay, this crust will take 1 to 2 days to fall down and it will keep a very pinkish. Thank you so much. Mom, still alive? Okay. Thank you so much.
And I hope Usman will take it as a deterrent from smoking as well.
Excuse me? Are you asking me?
No, I'm just saying maybe the patient will think twice about smoking, continuing smoking.
I cannot say this for him.
Well, that concludes this
Okay,
session.
thank you. You posted already?